Let's talk about client identification. Right. So we do this to avoid what? Error. Trust me, this is one of the safety concerns on the NCLEX exam. Now, let me tell you how the NCLEX tests the question. So you have your question like this, right? Now, NCLEX can test you about client identification related to all this right here. Now, let us use the first one as an example, medication. Now, NCLEX can say you're about to administer a certain medication. Now, in your mind, you are thinking about, oh, I don't know this medication. What is this medication all about? But guess what? NCLEX might not be testing you about the medication. Instead, NCLEX might be testing you on the ability to avoid what? Error related to what? Client identification. But you are not going to know because NCLEX is not going to say, NCLEX is not just going to put it to your face and say you should identify client. No. But if you look at your answer key, you will find out that maybe if the NCLEX is testing you on client identification, for sure, if NCLEX is testing you on client identification, one of your answer key will be related to what? Client identification. So most of the time when I see certain question that is testing me on medication or treatment procedure such as medical or surgical procedure, diagnostic testing or transfer, instead of me to be so bothered about what what medication are they testing, the treatment, the procedure, diagnostic testing or transfer, I go straight to looking at what my answer keys to find that if I can easily see any certain clue in my answer key, such as if the NCLEX is testing me about client identification, one of the answer will be related to client identification. So at that point, it makes sense to say NCLEX is trying to test your ability to avoid what? Error. So that would be the initial thing you are going to do. Right. So it's definitely going to be your answer. I can guarantee you that. So if you see any question related to this, sometimes NCLEX might test you about client identification. Not all the time. Because sometimes NCLEX might test you about the medication, sometimes it might be related to client identification. But how would you know if you did not scan through the answer key to see? So this is one thing you need to know. Right, so if you see question related to this, NCLEX might just be testing about client identification. So check your answer key to find answer related to client identification. So if you see answer related to client identification, select it and move on. But if you don't see any answer related to client identification, then it means that the question is testing you about the medication, the treatment, the procedure, the diagnostic testing, or transfer. Now, we have various ways we identify clients. We have full name, date of birth, medical record number, ID band, photo ID. But we only want to use what? Two identifiers, such as the name and date of birth. One thing you need to know is that client identity must match documents such as the medication administration record, lab or test requisition forms, right? Or the physician order, right? All these kind of documents, your client identity must match them, right? Now you want to do one thing and you don't want to do the other thing. Now this you want to do it, this you don't want to do it, right? This is also appropriate, right? Now you want to ask your client to state their full name and date of birth while you confirm with their ID band. What you don't want to do is to say, is your name John? Because now you are saying their name for them instead of them stating their name. You want them to state it, not you saying their name, right? You also want to use barcode scanning if available. So if you have one of your answer key talking about barcode scanning, select that particular answer. Don't only wait till you see name and date of birth, right? So select that particular answer. Now, when we are trying to verify client identity, please don't use these two things. Don't use the client room, right? Or bed number. So don't use the client room or bed number. Please. NCLEX will try to trick you with this, right? NCLEX is going to trick you with this. So don't use the client room or bed number. Now, lastly, we have special consideration. These are clients that don't have the ability to verify their identity. Now, we have non-verbal clients, unconscious, language barrier, pediatric clients, confused clients. For this kind of clients, we stick to using any of these. So you can select any of these related to what the NCLEX provided. ID band, medical chart, family, guidance, photo, medical record, certified interpreter, not family member. Now for this particular client, we use certified interpreter, not family member. For pediatric, we can use their guidance, family, photo for confused clients. ID band, we can use ID band for everything, medical chart for everything, medical record number for everything as well too. So this you use for special consideration, and for client that can identify themselves, you use their name and date of birth alongside, you tell them to state it, right? State their name and date of birth while you verify with the ID number. So this is what you need to know for the NCLEX exam. So please remember this, don't use their room or bed number. I'm going to see you in my next video.